Welcome, everyone, to this podcast. I'm Mark Blanchard, Public Sector Director for GovNews, and as part of our series of talks today, looking into the public sector's communication conundrum and how to support staff deliver effective services and improve lives whilst overcoming technology silos. This year, GovNews partnered with RingCentral to survey the public sector and analyse their adoption of innovations in areas like cloud communication and omni-channel engagement and AI. 500 participants completed our survey, more than half of which were at C-suite director and senior management level. And this whole series of talks has been to examine some of their insights and opinions and real-world experiences coming out of that research. And today we're going to be focusing very much on the topic that's on many people's lips. We're going to be talking about AI in public sector. So my guest panelist today is the National Clinical Lead for AI and Digital Workforce at NHS England. He is a practicing general practitioner in Northwest London, joining Kent, Surrey, Sussex Academic Health Science Network in October 2022 in a job share as the medical director. And alongside this role, he continues to act as the National Clinical Lead for AI and Digital Workforce at NHS England within their Workforce Training and Education Directorate. In 2018, my guest was appointed the National Medical Director's Clinical Fellow to Professor Wendy Reid. His key achievements were co-author and member of the Sir Keith Pearson Commission into NHS Staff and Learner Mental Health and co-founding the Topple Programme for Digital Health Fellowships launched by the Secretary of State for Health and Social Care in 2019. He's been a senior lecturer at Brunel University in London, supporting the Physician Associate Masters of Sciences and New Medical School, developing its digital educational strategy and curriculum, and has recently joined Keele University as an honorary senior lecturer, working within the European partners to develop a master's in explainable AI in healthcare management. He also sits as a member of the NICE Technology. I don't know where you fit all this in all honesty, but he's a member of the NICE Technology Appraisals Committee, an advocate for safe and ethical digital transformation and ensuring workforce are prepared for new innovations in technology in health and care. No doubt, and obviously he's a regular speaker internationally and has contributed to many publications and academic papers on this issue of workforce education reform, digital health and AI, and outside of work, for good measure, enjoys travelling, football, and you're likely to find him touring England's best restaurants with his family, and probably a point that I can relate to very much. But I'm delighted, and it's a great pleasure to be speaking with Dr Hatim Abdulhussein. Hatim, great to have you with us.
Lovely to meet you, Mark, and looking forward to our conversation. And for the listeners out there, prior to this, we just had a conversation about football and recognise that we are both supporters of clubs on two sides of Manchester. So if you feel any tension, it's because we just had that chat.
Not at all. I'm sure we'll get on well. Happy bedfellows. Unlike the healthcare sector and IT at times, but not as the case moving forward, I'm sure. But yeah, it's a real pleasure. I'm so excited to have you on this podcast. And we've got the next 20 minutes or so let's get straight underway if we can. So talk to us about the attitudes of, I suppose in your area, the attitudes of the NHS towards implementing AI, and how might education actually play a role in changing those attitudes?
So first and foremost, in terms of attitudes towards AI, there was a really interesting piece of work that was done by the Health Foundation, and that is one of England's think tanks around health. And they did a report called Switched On. And what they do in that report is they look at what staff and public attitudes are towards automation and AI. And for me, when I started this role, previously it was at Health Education England, and then we've transitioned to NHS England. That was really important because it started to give me that background context of what people do feel like about AI. And the reason why that's important, because it then means what do you do in terms of the educational offer around it. And what they found was that certain staff groups, but overall healthcare staff and also the public in general, felt kind of in the middle, or sometimes even more net negative about AI than net positive. What they also found is that some staff groups were more positive than others. So for example, doctors and dentists and allied healthcare professionals were actually more positive about AI than some other staff groups like nurses and healthcare support workers. They also compared gender, which I think was really interesting. But the thing that really struck me the most is they looked at familiarity. And they said, if you're familiar with AI, are you more likely to be positive or negative about AI? And basically what they found is the people that are familiar with AI are about kind of 70 to 80% net positive about AI. The people that are unfamiliar with AI are around kind of 30% positive about AI. So you can, and that's rough numbers without looking at the report. But what I'm basically saying there is, it's quite clear that actually if people are familiar about this technology, they're suddenly more confident in its use. And that led to a piece of work that we did at Health Education England and with NHS AI Lab to look at healthcare worker confidence in AI. So one of the things that are going to drive people to feel confident about it as a technology, and one of the things is education. And the education sits into kind of various formats. That's kind of generic understanding, demystifying, making people understand what is AI as a technology. And then it's more hands-on, advanced learning for those that actually want to be in roles that are actually using AI more actively, or making leadership decisions around AI, or procurement decisions around AI, or and then finally, kind of what is the hands-on, advanced learning offer that we can bring people on together with. As part of that kind of more focused AI journey to create the kind of experts that we're going to need in this space around AI. So if you're going to have future experts in AI in healthcare, what is that specific learning and pathways that they might need to follow? What opportunities can we create immediately? And we recognize that a lot of the problems sometimes when we see new technologies being taken on is because you haven't had any specific product-specific training. And that product-specific training is really important because, I've in the past, I've had to use technologies in my practice and I haven't really had that kind of product-specific training around. And then therefore, you're almost trying to find a way to use it effectively to deliver good patient care. And what we need specifically is the companies that are introducing new technologies into the NHS that clinicians or other people or staff need to use, have the right training support necessary to be able to make sure it's used in the right way. And that means that actually it improves patient care, it works as it was expected to do, and it has better evaluation overall. So it's kind of a win-win for everyone.
So how do you think AI is changing in the context of an organization's digital transformation efforts or its strategy, and what role does AI play in this whole transformation agenda?
Yeah, I think it has the potential to play a tremendous role. I also think there's always the risk that actually it's hyped too early, and I think there's always that concern with something like AI that people get too excited about it. And I think the really good representation of this is that Gartner curve of kind of tells you where are certain technologies in that kind of hype cycle. And there's that kind of point where it reaches a kind of a peak of hype, and everyone gets very excited about it. But then they realize actually it's not going to deliver all these exciting things, and they get into kind of a disillusionment around the technology. But the pace that you want to be is what we describe as the slope of enlightenment. So you get to a point where actually now you suddenly realize you've kind of been through all these amazing things it could do. You've kind of got past actually it doesn't do all of those amazing things. And then you get to a stage of actually these are the practical things that we can do with AI. And I think where kind of if you're thinking about kind of C-suite level, kind of board level organizations need to come to is being really pragmatic and understanding that kind of slope of enlightenment. What are the things that we can realistically do with AI right now? Where should our focus be? And what will be the benefits of that? And how do we measure that properly? And I think that's where we need to get to.
Okay. So those use cases, in what ways does AI positively impact, well, as part of our research, we were talking it in the circumstances of customers, so in your instance, patients or employee experiences. In what ways does AI positively impact those experiences, and what specific tasks or processes is AI going to help to automate?
Yeah, sure. So we did a publication last year called AI Roadmap. And this was an overview of the AI and data-driven technologies that currently exist within the NHS, a kind of a spotlight of that, or a stock take of that. And we started to look at, well, what groups do they fit in? So, for example, we found that 34% of the 240 technologies that we found in our kind of scanning were around diagnostics. We also found that 34% were on automation and service efficiency. And then we saw growing amounts of technologies in kind of what we describe as P4 medicine. So that's participatory, preventative, predictive, and personalized medicine, and remote monitoring and digital therapeutics. But the core were those two areas, kind of diagnostics and automation and service efficiency. So let's then kind of delve deeper into each of those. And we did that work to understand how it would impact the workforce. So if we look at diagnostics, for example, majority of those technologies are things like using automation or AI to help us read X-rays faster. using automation or AI to help us diagnose stroke earlier. And we have seen tremendous impact of those types of technologies. And the people interacting with those technologies are mostly going to be clinicians, but also administrative staff that are managing some of those processes around the reporting back of images back to the clinician that needs to see it, and all the systems that's going to sit behind that. And then in terms of automation and service efficiency, I think the best example I can give you is my practice. So in the practice that I work at, we're kind of an average side practice in West London, in Eastcote. We serve 8,500 patients to kind of circa 9,000 patients. And we have been looking at how we use automation and service efficiency, because we have huge turnover in reception staff. Our administrative staff are really kind of, they've been around for a long time, and therefore change is often quite difficult for them because they were used to working in a certain way. But the demands on the practice just continue to increase. So we see more and more letters come into the practice. We see more and more requests for an appointment. We, as clinicians, get more and more administrative work. So I do more referrals, more looking at blood results, all of these sorts of things that are very administrative tasks on top of seeing patients, which is actually what I want to do, is sit in a room and see patients all day and help them. I don't want to be doing all the administration behind that necessarily. And so what you are seeing is a group of technologies, and mainly they're still at this kind of robotic process automation stage. So not really what we describe as, some people put it in an umbrella term of artificial intelligence, but not really kind of more intelligent automation. Or even if you go further down that line, of course, you get kind of the role of kind of pure, autonomous intelligence. But it's not really at that place yet. And obviously we talk about frontier AI models and generative AI. All of those things are not, they're not within reach. They're not things that people are doing right now. But we are seeing robotic process automation. And where we're seeing that is we're seeing it help to register patients to the practice more quickly. We're seeing it releases time for looking at things like normal blood results. So we're seeing these kind of early applications of that technology. And I imagine, as that kind of expands further, and we start to incorporate some of the other things that are in machine learning, deep learning, and in frontier AI technologies like foundational models. Once we start to integrate those, we could get to a really exciting space. But even now, we're seeing that early impact. And so for me, it is really focusing on those two areas. If those are the areas that we know well, we need to kind of work to grow those areas.
Yeah. Like you say, there's been some huge success with RPA and DPA, and taking it to that next level of AI and looking at how it can positively impact customer employee experiences. Especially when it comes to patients, what do they want? They want reduced waiting times. They want improved service quality. Do you think they'll accept engaging with a chatbot to be able to get those things from healthcare? And what can you suggest is making a positive impact on the patients when it comes to AI that's being deployed right now?
Yeah, that's really the crux of the question for me, is how do you bring people along on this journey, and what do we do to make sure that people are comfortable with the new ways they might be working with? Now, I think the pandemic was really important for this, right? So as a result of the pandemic, people realized they were interacting with services in a different way. But as part of that, you need to make sure nobody is excluded. So digital inclusion is a really important thing. And if you're going to use these technologies, you need to make sure you have pathways in place for those that are not going to be able to interact with those technologies. So not everyone's going to be able to use a smart bot or a chat bot to interact with their healthcare surgery. My grandma, for example, not going to be able to do it. And I remember, actually, it's quite funny because it wasn't too long ago. It was kind of earlier this year, I was sitting with my grandma, and you know how if you want to access your GP surgery now, you have to do one of those online forms, and she was told she had to do one of those online forms. So I was sitting there doing it with her, and she was, and bless her, there was no way she was going to be able to do that herself. She needed me to be able to help her to do that, and not everyone has that support. Not everyone has that kind of someone to call upon. Also, I don't think my grandma wants to be ringing me every time she wants to try and access her GP to help her do a form. So we have to be really careful about what we put in front of people. Yeah. However, there are a significant amount of people that would benefit from actually accessing their GP in a different way. But then what we saw is when we introduce these types of technologies, so that, for example, there's online forms that people fill out, they create excess demand on practices that then often can't deal with that excess demand. And so we have to be really careful in trying to make sure that we can make these things as efficient as possible, because we can try and be more efficient, but if we're making things inefficient as a result, then actually that doesn't get us to the end goal. So for something like a chatbot, it's really important that behind that it's got a really good interface, a really good pathway in place so that whoever receives the information that comes out of that chatbot is able to act on it in the right way and provide the right information back, or the person that fills out that kind of interacts with the chatbot sees the right person or gets the right advice. So someone really needs to be making sure that's happening, and that's happening safely, because ultimately when it comes to healthcare, we're talking about people's lives. And it's a heavily regulated industry for that reason. So we need to make sure we do it properly. So I do think there's potential. And now, you are seeing, for example, the benefit of having chatbots, for example, at kind of hospitals that then kind of help you with simple requests like, who do I need to get through to, or, what more information do I need about my appointment, or which building do I need to go to? So you might see those types of benefits really helpful in that kind of initial smart chatbot interaction. So you can kind of test it out. And then and then you can start to evaluate that and see its impact before you start to kind of encroach into areas that kind of require more clinical interaction or more clinical risk.
Okay. So on the other side of the coin, when it comes to employees' communications with each other, or indeed, an NHS trust to a primary care organisation, those type of communications, and how those are streamlined, whether to support the new hybrid and new ways and smarter ways of working that the NHS have adopted so well over the past few years. Do you reckon AI can be leveraged in those scenarios?
I think it can. And I think it can help, particularly when you're in a massive organization, particularly trusts and kind of other types of organizations like that, when you're trying to get information about another area and you need to know who the right person to contact is, and also to try and take some of the pressure off colleagues as they try and contact each other. Particularly because, we know that in the healthcare workforce, it's not the most resourced healthcare workforce. It's kind of, there are significant challenges around resource. That's why there's a long-term workforce plan out there to try and address those significant challenges. So, when you've got that already in place, it's helpful. Anything that can help us communicate better kind of within organizations would be tremendously helpful. And then even across organizations, look, I as a GP often want advice from a clinician from a secondary care, so what we call as a hospital. So I want a specialist to give me some advice, or I want to speak to the specialist nurse on an area, or I want to I actually just want to very quickly speak to someone on a ward somewhere. But that's a very difficult communication to enact. Now, one of the things actually that's been really transformative to my work as a GP in the last few years is something called advice and guidance. And what that means is when I've got a patient and I'm not sure about what to do with them and I need some advice from a specialist, I can send them a note and say, hey, this is this patient, this is their details, what do you expect me to do next, or do you need to see them? And they can come back to me with a plan, and therefore the patient saves some time and doesn't wait on a waiting list for ages because they've already got a plan in place after the interaction that I've had with that healthcare professional in another organization. So I'd love to think about how automation and AI will help nurture those relationships, because one of the challenges with that has been it works. For me, I would describe it as working really well, but it also adds added capacity on people. Because someone has to then go on top of running their clinic, has to go and read through all of those requests from a GP and kind of make a decision about those. So, if there's a way of streamlining that, and again, we have to be careful because this is where we encroach onto kind of clinical risk in clinical areas. But if we can make people communicate across boundaries better, that would be amazing.
Yeah. So we touched on earlier on about the educational aspect. The more we can educate and talk about AI, our organisation's going to feel more confident in the journey and the roadmap to using it. How are public sector addressing all the other challenges and doubts surrounding the implementation of AI in their organisation? Is it that fear that, well, what if it goes wrong, or human in the loop? What strategies are proposed, I suppose, in healthcare settings to overcome some of those obstacles of challenges and doubts?
Yeah, well, the first thing I'd say is a safety first approach. It has to be. Yeah. We published a report called, two reports, Understanding Healthcare Worker Confidence in AI and Developing Healthcare Worker Confidence in AI. And in these reports, we presented a framework. And that framework basically gives an overview of what we need to do from a national point of view in healthcare, what each organization needs to do, and therefore also what you need to do as a user of AI. So I won't focus on the user bit, but I will focus on the national and the organizational bit, because I think those bits are relevant. So nationally, we just need to make sure we have the right regulation in place and the right standards in place, and things go through that appropriately. And I think there's been tremendous work that has been done to help us get there. There's an AI and digital health regulation service now offered, which allows those that are developing the technology or those that are adopting the technology to understand which steps need to be taken for something to have the right kind of the sign off. And at the same time, we also need to address things like, what are the liability issues around using these technologies and who does that sit with? And having those conversations is really important because as a GP, I have professional registration with the General Medical Council. Now, I don't want to put that at risk. And so, what are some of the risks that might come into play when using these technologies? And these are the things that will need to be addressed. But then at organizations, it really is about having the right strategy in place. It's about having the right leadership from the top that understands the technology, understands what I described earlier in terms of that slope of enlightenment, and also that has the right culture. So people within the organization are ready to change and ready to adopt change. And, the organizations that are really good, for example, that have been developing or adopting new electronic healthcare records, which ones have done that well? What have they done well about it? What was the culture that they orientated or created that allowed them to do that well, that their staff use that electronic healthcare record in a good way? Because we know the adoption of these technologies are effectively people and process first rather than the actual technology itself. And so those, for me, are the critical areas. And then the final bit is validation. So with this technology, you need to make sure it's validated. Now, you need to have an external validation because it needs to be independent to show it works. And then you need to, when you actually put it in place somewhere, you need to be able to internally validate it. Because as you know, and I'm sure the listeners might know, is that AI is really subject to the data that sits underneath it. Yeah. And there's that common concept of garbage in, garbage out. So when we're using patient data, we have to make sure it is appropriate. It's the right data. It's representational of that patient population. One of the things that we've been doing in Sussex is working to build up their Sussex integrated data set and then looking at kind of use cases as a system to say, how can we prevent falls in the patient population in Sussex? Because as an area, it's got the higher than average falls in England. And as a result of that, what kind of things can we do? But we need to make sure we have the right codes in place to be able to make sure that we're actually capturing the right things, to be able to identify people that are at risk of fall. So the quality of the data is really essential to any of this. And so we need to make sure that those standards are really upheld. And when you do validate a new technology within an organization, it's right for that data set. It's right for that population that organization serves. Because something that might work for my patients in Eastcote in West London might not work for patients up in Newcastle, for example. So, we can't make the same generalizations on this technology. We have to be really careful and do a certain level of local check-in to make sure it is the right technology to be using. So I think those things are going to be really important for any organization to consider, and having those kind of governance and pathways in place to be able to kind of assure the technology and validate the technology and evaluate and monitor it once it's in use. And I think this applies to if it's a clinical technology or a non-clinical technology. As long as it's interacting somewhere in terms of the patient pathway or on patient care, we need to make sure it works safely.
Yeah. So we've obviously seen in various news headlines, when communications fail in healthcare settings, letters go missing. We've got this 8 a.m. rush for doctor's appointments at the GP level. Are there any recommendations or best practice that you could talk about when it comes to embracing AI in order to improve communications within healthcare settings in terms of how they adopt the technology?
If I'm honest, I think we're still at quite an early stage with it. As I said, I think there are some good examples of the use of robotic process automation. But if I had to say to you, apart from diagnostics, where I think there are some really good examples, if I had to say to you in the communication space, where is a good place that has managed to use it? Whilst there are pilots going on in various areas, and we'll soon actually, if you ask me these questions in a year's time, I might say to you, absolutely here, here, and here. I haven't seen any strong evidence from my perspective, and that's for me kind of sitting nationally on this as well, and people often coming to me on this, that has demonstrated that this is working really well anywhere yet. Right. That doesn't mean that we've got some early lessons to learn from things like robotic process automation, for example, and what's been successful there. I think there are some really good GP partnerships and federations out there that are doing really good work. For example, a few come to my mind in the Midlands, like Modality, who are doing some really interesting stuff with the way that they use technology as a group of GP practices. And I've also seen other kind of federations of GP practices do this. And so, and then even within my region, we are now, testing out in Northwest London in the integrated health and care system in the GP surgeries. We're running a pilot of the use of robotic process automation and starting to see the evidence come out there. So my own practice will be adopting it, for example, for a 6-month pilot to improve some of the things that we do. So we are still at an early stage, but I can definitely see in the next year or two some really good clear-cut evidence form to say that actually this works and we need to go quicker and faster with this.
Does it come down to that risk element that, if I was to ring a GP and I'm talking to a piece of automation and there's a risk that actually that automation is deemed that actually I'm better speaking to the pharmacy rather than waiting in queue to speak to the GP, and then I take that advice and I go down that channel and it's the wrong channel? Is that the risk element and the concern, do you reckon?
100%. So in my role as medical director of Health Innovation Care in Surrey Sussex, we support innovators and small and medium enterprises to help understand the challenges of the NHS. And we do that kind of needs articulation, but we also help them with kind of value proposition, and we help them understand, is this going to work? Is this something that you should be looking at? And then we support them to run some pilots and evaluations of the technology locally in kind of small settings, safe settings. Now, I remember sitting around with one of these technologies that is used in primary care and saying to them, they've been developed in another part of the world. And just to keep it confidential, I'm not going to say where, because it's easy to identify the company. But what I am going to say is they were developed in some part of the world. And they've come over here and they said, we've got this technology that can automate using AI, triage patients to the right place, to the right time, based on the information they provide us. And I thought, great, this is amazing. Great. Because actually, having seen how my practice has had to deal with online consultations and the challenges that we've had, and I did a whole digital transformation piece within the practice to change how we do it. But I can't say we've even got there yet. It's still very difficult. It's still a challenge. It's better than what it was. And we have a better pathway now, but it's still in motion. So, the premise of technology, amazing. I would love to see it work. But is your data set that's been built in this part of the world really representational of people that access primary care in this part in England? And that was a key question for me. And so, look, fair play to them. That's why they were talking to us, because they want to test it out. They want to build that evidence before they do anything. So it is really trying to understand what that risk is and making sure that we actually come out with, here is the evidence. Here's the independent evaluation of this technology, and here's the impact that it made.
Okay, well, with that scenario, what role is AI going to, when it comes to, I suppose, the less riskier, the mundane, let's improve operational efficiency, let's reduce these mundane tasks, increase efficiency. What role can AI play in improving those internal communication mechanisms that go on between interdepartmental or customer communications? What's the quick wins there, do you think?
Yeah, I think that's where we can have the biggest impact. Yeah. There's kind of back office functions. So, for example, a few years ago, I was part of the Staff and Learners Mental Health and Wellbeing Commission. Actually, mentioned it at the start, and that was a commission looking at the well-being of staff in the NHS. And we made some recommendations for how we contribute to and improve the well-being of NHS staff. Because our ambition and our vision at that point was making the NHS the best place to work. Now, if you're going to make the NHS the best place to work, you need to make it easy for people to find out things that they need to know. So, for example, if I wanted to know what my annual leave allowance was, or what my maternity policy was, or paternity policy in my case, if I wanted to know that information, I want to be able to get that information really quickly. Now, if I'm honest, it's not easy to get that information.
Right, okay.
It can be quite difficult. And that leaves people feeling a lot of resentment sometimes. And so I think what we could do better is use technologies that allow people to find out the things that they need to. And that's very easy to be able to interact with a chatbot that takes you to the right policy in seconds. Actually, I know that can be done right away because I've seen it being done right away. I've spoken to friends that work, and I'm not going to name the company, but I've spoken to friends that work in a company that said, yeah, we have that, and it's amazing. We love it. And so I think, if the NHS can adopt these types of technologies, that's one thing that makes an immediate impact in making people happier. And making it easier for people to work. And so that's one example is like, really trying to understand the HR policy or the information governance policy, and then being able to test out if what you're doing is the right thing. For example, using AI as when you're trying to do some kind of new, take something through something, or do some assurance or performance checking. Those sorts of things of keeping up to date with policies and guidelines within organizations, and making sure what you're doing is keeping up to date with all the policies and guidelines within an organization. That would be a tremendous benefit to the NHS, because it is very hard. It's very hard to find the right guidance at the right time. And what you want to be doing, as I said to before, I don't want to be spending my lunchtime or spending kind of hours kind of look for the right document that tells me how to deal with this, when actually I could be seeing patients and really benefiting to patient care. And I think
that's
that
what it all
applies
comes back to, doesn't it? That time with patients. That
and even for people that are not patient facing, for administrative staff and people like that, they want to be doing stuff that directly impacts on patient care. They want to be able to support patients, support patient flow, and make things better, that experience better for patients. So if we can release them to doing that rather than some of the kind of more administrative work that actually isn't enjoyable, I think overall we'll have a happier workforce.
Yeah. Are you using it to improve like the happiness and the effectiveness of the workforce, in a sense of, you've seen some of the features on things like Microsoft, where it can tell you, look, you've not allocated any time for your lunch this time next Thursday because you've got back to back to back, or you're jumping from one team's meeting to the next. Is there anything? Did the NHS need to go much further in those things in order to keep morale up, keep operational efficiency up? Is it part of like that long-term workforce strategy that's been talked about?
So a big part of the long-term workforce strategy is about retaining staff. And I think there will be things that AI can do to help retain staff and help people valued and happy in the NHS, as I've described. And part of the work that we will do is to understand where it is best applied, and that might be one of the best places that it's applied. I've actually seen a couple of technologies in this space, and again, I'm not going to name them, but they're very good for kind of supporting staff exactly in the way that you described. How are you feeling this morning? What's your day looking like? Have you done this? Have you done that? Have you looked at this resource? Here's a kind of 5 minutes of headspace type thing. And there's also other things that are kind of similar in that way of saying, how do you feel after your clinic today? Are you feeling positive, negative? And therefore, it allows people within the organization to keep better track of how staff wellbeing is. So I'm seeing those types of technologies come in, and I think there'll be incredible growth in their capability. So that would be very exciting to see that happen, because for me, there's something called a quintuple aim, which is basically what any Western healthcare society wants to get to. And a big part of that quintuple aim is making people that work in healthcare feel valued, and making them and supporting their well-being. And if we can check that box, we will be one step closer to being that perfect, that kind of visionary healthcare system that we want to be.
Hatim, I feel we could have continued this discussion for much further. It feels like we're only just getting started, but sadly, I'm disappointed to say that's all we've got time for today. But thank you so much for speaking with me, the National Clinical Lead for AI and Digital Workforce at NHS England, Dr Hatim Abdulhussein. It's been a real pleasure speaking with you. Thank you.
Thanks, Mark. Really enjoyable. And look, we're really at the kind of start of this journey, and I think the next few years are going to be really exciting to see the impact that this technology has. But it all comes down to one thing: how do we keep people safe? And so that has to be critical to anything that we do here.
A great way to finish. I'm Mark Blanchard of GovNews, and thank you very much for listening.